Now, the Delhi government has relaxed the ongoing lockdown to open up some services in the national capital, which has seen close to 3,000 coronavirus cases so far. The Delhi government has lifted the bar on veterinarians, plumbers and electricians after a complete review of the COVID-19 situation in the national capital. In an order dated April 27th, AAP government has allowed interstate travel of health workers, lab technicians and scientists. The government order allows shops of electric fans, educational books, shelter homes to open up. The Union Home Ministry had earlier cleared these activities, but the city government, in fact state governments, had waited to review the situation.
दिल्ली में कुल मिलाकर अभी तक 3108 जो पॉजिटिव केस पाए गए हैं, जिसमें से 190 केसेस कल ऐड हुए हैं। 877 लोग रिकवर हो चुके हैं, 54 डेथ हैं, कल कोई नई डेथ नहीं हुई है। तो 2177 जो है एक्टिव केसेज हैं। तो लॉकडाउन है तभी इतने केस हैं, अगर नहीं होता तो दूसरे देशों में लॉकडाउन बढ़ाने की जरूरत महसूस हो रही है सर। मुझे लग रहा है कि शायद 7 दिन है, अभी 7 दिन के अंदर देखते हैं क्या क्या होता है।
Maharashtra and Gujarat, the worst affected states, now account to at least 50% of the cases across the country. 522 new cases were reported just in Maharashtra in the last 24 hours, taking the total number of cases in the state now to over 8,500. 27 fresh deaths were reported, of which 15 were in Mumbai alone, taking the total death toll over 350. Mumbai, the worst affected city in India, has over 5,700 cases. Over 1,45,000 people are currently in home quarantine. There are about 805 containment zones in the state. Gujarat, on the other hand, has reported 247 new COVID-19 infections and 11 deaths in just a day's time. Ahmedabad is the largest cluster in the state, with over 2,300 cases reported from Ahmedabad itself. Over 100 deaths reported in Ahmedabad. Gujarat continues to remain the second worst hit state in India, with over 3,500 confirmed cases of COVID-19 and over 150 deaths. In Pune, a veteran homeopathy doctor has dedicated his 8-story 100-bed hospital in treating COVID-19 patients. He is still awaiting a nod from the government. My colleague Pankaj Kelkar brings you more.
A 100-bed homeopathy hospital in Pune has dedicated itself to the COVID fight. It has urged the centre and the state government to allow it to treat patients using homeopathy.
होम्योपैथी से एक्यूट पेशेंट और वायरस से पेशेंट को ठीक करना एक चैलेंज है। मैं उम्मीद करता हूँ मेरी ये सेवा मेरे देश के काम आए, कोरोना पेशेंट के काम।
In Feb, Dr. Nikam had even written to the Chinese government seeking an opportunity to help patients there.
मैंने इंडियन गवर्नमेंट के आयुष डिपार्टमेंट पंतप्रधान मोदी साहब को हेल्थ मिनिस्टर को बोला है, रिक्वेस्ट की है कि हमें अलाउड करो होम्योपैथिक ट्रीटमेंट देने के लिए।
On its own, the Pune hospital is reaching out to a number of people through phone calls and based on their case history, offering to help them with homeopathy medicines.
कोविड-19 के लिए प्रिवेंटिव मेडिसिन हम प्रिस्क्राइब कर रहे हैं, तो उसके लिए फ़ोन पे बेसिक हिस्ट्री जो होती है, फिजिकल, जनरल्स, थर्मल, वो हम पेशेंट से लेते हैं और उनको उस टाइम पे मेडिसिन प्रिस्क्राइब कर सकते हैं। तो आसपास के फार्मेसी स्टोर पे जाके मेडिसिन ले सकते हैं। तो इस तरीके से हम लोगों को प्रिवेंट कर सकते हैं कोविड-19 से।
While the centre has been pushing for the use of Ayush as means to build up immunity, giving a hospital the rights for full treatment is yet to happen. With Pankaj Kelkar in Pune, Bureau Report, India Today.
Now, with just 5 days left till the lockdown 2.0 comes to an end, all eyes are now on how states plan to relax these curbs in red, orange and green zones after 3rd of May. 4 states have advocated for a lockdown extension during Monday meeting with the Prime Minister. Worst hit state Maharashtra batted for full lockdown extension in hotspots and requested the centre for food grains as well. While West Bengal Chief Minister Mamata Banerjee suggested to go with a partial lockdown and told Prime Minister to bar flights interstate, buses interstate as well, and long route trains even post May 3rd. States like Tamil Nadu, Rajasthan, Puducherry, Jharkhand, Punjab asked for immediate central assistance to combat COVID-19, while Karnataka has urged the Prime Minister to maintain status quo, citing the current situation, even though it seems like the state is suffering with funds. Delhi is yet to formulate a comprehensive plan after 3rd of May.
एक म्हणजे आमकां डायरेक्ट उलोवपाची संद नाशिल्ली आयजूय बी फक्त 9 सिटींग सुमार आशिल्ली तर आमचे रिप्रेझेंटेशन आमी धाडून दितले आमचें म्हणणें आसा की लॉकडावन एक्सटेंड करचो म्हटल्यार इकॉनॉमिकल हे जे आसा एक्टिविटीज जे आसा विदीन द स्टेट इट शूड कंटिन्यू बॉर्डर सील उरच्यो देर इज नो ट्रेन नो प्लेन नो पब्लिक इंट्रास्ट।
अभी दिल्ली को लेकर जो तस्वीर दिखाई दे रही है वो 3 मई के बाद मतलब 3 मई करीब आने पे ही तय होगा और 1-2 दिन बाद 2-3 दिन बाद सारे स्थितियों का आकलन करते रह के तय कर पाएंगे। आज 3 मई के बारे में कुछ कहना है, 3 मई के बारे में बात कुछ कहना है कि कितना लॉकडाउन खुल जाएगा। कोई भी मुख्यमंत्री अभी इस स्थिति में नहीं कि 3 तारीख के बारे में अभी से कुछ निर्णय ले सके। 1-2 तारीख को या अधिकतर 3 तारीख को ही सब इस बारे में निर्णय लेंगे कि आगे क्या करना है।
क्या 3 तारीख के बाद राहत मिलेगी राजधानी को?
अभी कुछ भी कहना मुश्किल है, इसीलिए कह रहा हूँ क्योंकि अभी 5-6 दिन है। 5-6 दिन पहले ये कहना कि 2 तारीख की स्थिति क्या होगी, ये कम से कम कोरोना के करैक्टर को देखते हुए कहना मुश्किल है। लेकिन आज जो हालात हैं दिल्ली में उसको लेकर बहुत चिंता की जरूरत नहीं है, पर अच्छे हालात तब होंगे इससे जब हम 3 तारीख तक के लॉकडाउन को और सख्ती से पालन करेंगे।
The liquor shops have been closed. Our revenue totally dwindled. Our economic situation in the state is in a very difficult position. Even for our state government, the meeting the expenses, the day-to-day activities also it will be difficult for us. Therefore, I told the Prime Minister the GST compensation, which has been due for the last 5 months, at least 4 months compensation to be released immediately.
Now let's quickly go over to my colleague Akshita Nandgopal, who brings us the need for a longer lockdown to beat COVID-19. Let's take a look.
India's done a 40-day lockdown, and let's break down what our data intelligence unit has put together for us. In Lombardy of Italy, which was a hotspot of coronavirus and saw a number of cases, there was a 57-day lockdown, after which the recovery rate was in fact brought to 29%. In Wuhan, China, epicenter of coronavirus, it's seen the maximum lockdown across the world, 77 days, which led to this kind of a number of a 93% recovery rate. In Spain, there was a 57-day lockdown, much like Lombardy in Italy, but their recovery rate is definitely better than Lombardy. The entire country of Spain managed a recovery rate of 41% after a 57-day lockdown. France, just short of 56 days, and we've seen a 25% recovery rate. And you see India's comparison to all the other countries as well. 40 days lockdown, much lesser than all the other countries, and our recovery rate at this point is at 20%. For us to improve this to perhaps 40% or even a 90% as China has, we will have to ensure perhaps a longer lockdown. Remember, these are the numbers as of April 22nd. Many of these countries have not entered their lockdown on April 22nd. Yes, they've eased some of the curbs, but they've continued that lockdown, which means that the recovery rate has improved further. So for India really to ensure that there is a better recovery rate, if you look at these numbers, going by the experience of other countries alone, we will need to ensure that perhaps there's at least a 50 to 55-day lockdown.
Hi everyone, Preeti Chaudhary here. Hope you like this video. For latest news and analysis, like and subscribe to the India Today YouTube channel. And don't forget to press the bell icon to stay updated. Thank you for watching.